Good afternoon. Good afternoon. This is Dr. Velma Scantlebury, and I am going live with Ask the Doctor this afternoon on October 15th at 4 p.m. Eastern Standard Time. I thank you all for joining. Again, this is Dialysis Patient Citizens Educational Center, and this is the opportunity for you to join and for you to ask any questions that's on your mind. So we will wait to see if some of the audience joins, and while I'm here, I will just pause so that we can have others join on. So thank you very much. And again, this is Dr. Velma Scantlebury on Facebook Live. This is Wednesday, October 15th, and I'm trying to move myself out of the direction of the sun, and hoping others would join today. Let me know if you're around, if anyone is here. Put your comments in the chat. Welcome, everyone. This is Dr. Velma Scantlebury. And if you have any questions, go ahead. This is October 15th, and we're now into fall. And I hope that for those of you who have transplants, as well as those who are on dialysis, please remember to keep up to date with your vaccination. And it's important to speak to your doctor, because remember that you are in an immune suppressed state. And even though there are very few reported hospitalizations from COVID and flu, just remember to stay safe. If you don't believe in getting vaccinated, make sure you wear a mask, and make sure that as you're out and about in various gatherings, that this is the time. So I really advise there's often windows where patients are not able to get vaccinated, such as immediately after transplant. Remember, with if you're being treated for rejection, if you're immediately after transplant within that first 3 months and you are on high immunosuppressive doses, you're not going to be able to develop the amount of antibodies that are needed to protect you by the vaccination. So it becomes essentially useless because your body is in a state where it's preventing immune reactivity. So generally for patients newly transplanted, as well as those being treated for rejection or being on high-dose prednisone, that those may prevent the vaccinations from working properly. So talk to your doctor about the right time to get those vaccines, to make sure that that you are doing the right thing. And generally, for whether it's the flu or whether it's COVID, for many people the symptoms are the same. Fever maybe is more common with the flu than with COVID. COVID may be just upper respiratory disease, upper respiratory symptoms, so throat, cough, and so it's most of the testing these days. If you go to urgent care or many different places, there's now a combined test for both the flu and COVID. So urgent care should be testing for both, because you know that as an immunocompromised, whether you will likely, or if you're over a certain age, there is treatment now for COVID. So you can get past COVID as long as there's no contraindications, and you know if the flu, then they will give you the appropriate anti-flu therapy. So it's important to differentiate. There are some home kits you can buy, but they can be very expensive. So make sure you get the appropriate testing. Again, I'm Dr. Scantlebury. I'm the medical consultant for Dialysis Patient Citizens Educational Center, and today we are on Facebook and talking with you, and thank you all for joining, Linda and Arthur, and let's see, Veronica Terry, thank you very much for being here. Question is in terms of skipping dialysis treatment. It is always problematic skipping dialysis unless it's advised by your healthcare provider. Some patients may have to travel. They may be a holiday. They may be, if you're terribly ill, then it may not, it's best to speak to your doctor. But just because you don't feel like it, or you're disgusted, or whatever it is that's driving you to not want to do dialysis because it makes you feel terrible, remember that by skipping dialysis, you're then now going to accumulate more fluid, make it harder on your body, and the next time you get dialyzed, you may feel even worse than what you anticipated. So do not challenge your body by skipping dialysis, because it's the way that it's your way of eliminating all those waste products that you are not able to do on your own. If you're making a small amount of urine, think of it as bladder sweat, because the things that need to come out are not coming out. And that is why you need dialysis. So it's the way of cleansing your body and getting rid of all those metabolites. So it's very important to not skip dialysis. Just think of your brain and all those toxic things that's going to play havoc on your brain, because now your BUN creatinine is now way up and your body is feeling really tired. Your blood pressure's up. You can't get that extra fluid off. So not a good thing to do. I don't advise it. Some people who may be on peritoneal dialysis and making large amounts of urine may be able to skip a dialysis treatment based on the fact that you can always double up, have an extra hour before. Oftentimes it's on the advice, with the advice of your healthcare provider, so that you can make up for that missing dialysis treatment that may be necessary because of your life circumstances. So thank you all for that. Thank you, Nancy, for that question. And thank you, Yolanda, for putting that information out there. Good afternoon, everyone. It's Wednesday, October 15th, the middle of the month, and we are into fall, so thank you. Grapefruit is a no-no for transplant patients. Generally, we tend to avoid anything that will interact with your pro-graft levels or your immunosuppression in terms of altering the levels. So for some people, we generally will stay away from citrus fruits, not only, and grapefruit, because it also interacts. There is another fruit that doesn't come to mind right now that also can, and also many of these citrus fruits also makes your potassium high. And so while you're struggling, why high potassium is also a consequence of the immunosuppressions, particularly pro-graft. So it's always a struggle to keep your potassium low. And so therefore, you want to stay away from any of those that will cause higher potassium, especially, yes, someone said pomegranate definitely is on that list. So if you're on the other scale of it and your potassium is low, then that may be a different story, but you also have to make sure that it's not going to alter your pro-graft levels. So thank you so much. Hello to Ken in Louisiana. Thank you for joining. And it's also, there are things that maybe you may like that can also be a no-no for you. So for most transplant programs and also for dialysis, you should have access to a nutritionist or a dietitian who can really advise you on the things that you need to eat. We know, for instance, that there are patients immediately after transplant who have trouble with high potassium. And so if you are a Hispanic and eat a lot of beans and rice, it may be impossible to avoid eating so many beans and rice, but to keep your potassium down. So, but it may be, how can you cut back so that your potassium is not always in danger? And now there are some other medications that can be given to assist in keeping your potassium under control, especially when you cannot avoid it or there's not anything within your control from that perspective. So thank you for that question. For those of you on dialysis, I would like to hear from you to see what is troubling you these days. Is there issues? We know that this is October. It's breast cancer month. Sorry for not wearing my pink, but make sure that you and your family members who are of age get the mammogram. Or if you're a male, make sure you love the females in your circle get the mammogram, because this is a preventable disease. And so it is important that even though you are suffering from other things, you don't want your life complicated by something that could be taken care of. Early treatment is better. So we know that for women, we tend to not want to do it, but it is something that's important. If you are on the list waiting for transplant, you know that you have to keep up with your mammograms and your cancer screening. So that becomes important, especially each year that you are listed in terms of being called in. You want to make sure that you're up to date with all those things, not just your mammograms, but also in terms of the things that you need to do, whether it's a stress test, whether it's making sure you're up to date with your sleep apnea study. So those things are definitely something to think about. Thank you all, Michael and Christina from Utah, living on dialysis. Awesome. Thank you much for being here. And for all the patient ambassadors, I thank you all for all your work and all the advocacy that you're doing to really make sure that patients on dialysis and patients with transplant, you're out there advocating for their rights, really making sure that policies and that that your voices are heard. And that's very, very important. So thank you for that. Binders and blockers, what's the difference in terms of binders, particularly within when it comes to phosphorus, the things that the dialysis machine cannot remove. You think about how do you get rid of the phosphorus? Generally, you want to stop not eating as much of foods that contain phosphorus. Binders will bind the phosphorus once it's in your system and your GI tract to keep it from being absorbed. And so that's for most people, it can cause significant constipation because it's really preventing after the fact. And so blockers are different, works within your bloodstream to block absorption of those phosphorus and phosphorus metabolites into your system. And so oftentimes, I'm sure maybe it's due to expense or insurance, most patients end up, easier route is to take your binders with your food and try to keep your phosphorus down. When all that fails and you're unable to do that, oftentimes after persistent trying and increasing, your healthcare providers may put you on a blocker to see if that would help. So if there's any of you on this line today who are on blockers and have been successful in lowering your phosphorus, please drop a note there and let us know how it works, what your if you experience any issues with it. And so we would like to know. I know most patients find that the binders are intolerable to some degree if they're having trouble avoiding the foods that are high in phosphorus. And it sometimes can be difficult for people to understand that you have to change your diet. And so that becomes very important to say, okay, I know I like cheese, but I have to cut it out. I know I have to give up dairy. I have to give up those colas, things that will, one, prevent deposition of those things within your blood vessels, because what we see on the surgery side is that we see abnormal phosphorus persistently high will end up with a deposition within your blood vessels. and the thickening and hardness as it deposits along with calcium, leading to significant vessel disease, which can eventually compromise your ability to actually get a transplant placed. So, all right, let me scroll back up. Can you address any new and upcoming texts or developments for dialysis patients? Certainly not anything I can comment on at this point in terms of, because it's really not my space, but I can look that up and get back to you with that. We actually just got awarded 2025 Kidney Support Group of the Year. Wonderful, and congratulations, Michael. That is wonderful to be able to be part of that. Thank you so much. I use milk thistle, phosphorus, and hemoglobin. And I hope if it does, I'll try to reconnect. Sorry, got a slow connection here. I hope you're talking about your hemoglobin A1C and not your hemoglobin that's accounting for your red blood cells. So River is a kidney recipient, 6 months post-transplant. Congratulations. I hope you're doing well. Oftentimes you're getting over that hump of issues with avoiding rejection, coming down on your medications, that sort of thing. So congratulations to you, and hope you continue to do well. Sensipar therapy is common. One of the things I see in patients who have a chronic kidney disease, and even after transplant, is the continually rise in PTH, or even after you've had because of calcium phosphorus imbalance. And so Sensipar is used and unfortunately is not well covered post-transplant, so it can be very expensive for many patients. And so it is used to keep your parathyroid hormone in check, because patients will get what's called tertiary hyperparathyroidism, which means your calcium from your parathyroids are overactive and therefore are seeping too much calcium into from your bones. And so it becomes important to fix that, because it will certainly lead to significant, number one, problems with your bones, and two, increasing issues with trying to figure out whether you have tertiary hyperparathyroidism. Some people will need it before transplant while you're on dialysis to control your PTH, especially if it continues to be high, and then even after transplant, if you have not had control of your parathyroid hormone by having either one or several of your parathyroids removed and placed in your arm to monitor, one, to decrease the overactivity of your parathyroid hormone. Generally, they would remove 3.5, leave a small portion so that your parathyroid hormone level can decrease. For some people, for some places, they will take that small piece of parathyroid that's left and put it in your arm so that you can monitor it in terms of knowing if it continues to rise. Then they know where exactly it is, and you do not have to go back in your neck. Off topic. Love your glasses. Thank you so much. Okay, all those congratulations to River Chris, Yolanda. Stay in touch. We're all in this together. Something to address. We talk all the time about low hemoglobin and all the things that come that, but high hemoglobin. Trying to see what's the rest of your sentence here. High hemoglobin can be just as bad. Watch these numbers very closely. So certainly, when you talk about hemoglobin in terms of the hemoglobin, we know that the kidneys control your hemoglobin production. And so with kidney failure and on dialysis, you're going to be anemic because you're not going to make enough hemoglobin. So many of you get erythropoietin or similar products on dialysis to make sure you are not anemic and to bring that hemoglobin level up to 9 or 10. But it it does need to be monitored, and making sure that you are not overshooting. And I think that's one of the reasons why you get labs on a regular basis. And certainly even after transplant, we find that the kidney can work perfectly fine. Everything can be in order, except for some minor things. They may still continue to be anemic. On the opposite side, you have patients who will get a transplant and make too much hemoglobin, and therefore their blood, the amount of blood cells becomes greater than 55%. You never want to really hit 60%, excuse me, because at that point you are at risk for thrombosis. Too many cells, not enough liquid, you can then be subject to clotting disorders. And so for many patients, they can be placed on medication to help decrease that, and one, to prevent you from having issues with blood clotting. Many years ago, we used to send patients to donate blood to reduce those red blood cells out of the system, especially when it gets very high. But now there are medications that can keep that number down and keep you from having issues with blood clotting, or stroke, or anything that has to do with thrombosis. And so making sure you're on aspirin and other medications. So thank you so much for that question. And so can you address artificial kidney talk? And there's been, I think one of the issues with the artificial kidney progression is about funding. It seems to be almost getting close to, I say almost, and that it's been in the development for many years, but we haven't gotten to. Okay, I think I'm losing folks because I'm losing. Sorry for that. There are technical issues. Please check your device. Okay. I am probably in a difficult spot right here, so I'm sorry about that. Trying to avoid the sunshine, but anyway, we're talking about the artificial kidney and different trials. I'm going to try to move my phone to a different location. I hope that's all right. I am going to try a different location. I hope you're still there, and try to see if I can continue this conversation. Let's see. I'm trying to get in the light. Okay. Sorry about that, folks. Thank you for bringing awareness. So one of the things we were going to address is the issue of the artificial kidney. And although it remains hopeful, there seem to be more work towards using pig kidneys than movement with the artificial kidney. And my concept is that it has to do with funding, and where the amount of funds are being placed, certainly when it comes to using xenotransplantation, that's happening at a faster pace because it involves multi-center trials or big centers with good funding, such as Hopkins and Boston and New York, in pushing the. I don't know if anyone is going to jump on, but there certainly is issues with connection today, and I apologize for that. And hopefully we can continue this conversation next time. Please add your questions to the Facebook page, and I will do my best when it comes to answering any questions you may have. So thank you so much, and let's see if there's an option for others to jump back on. All right. Sorry, guys. It just seems like the internet is playing havoc with me. I had some issues at work, so I came on home hoping that it would be better here for me to have this connection. But sorry about that. But I hopefully I answered all your questions. Feel free to post any on the Facebook Live Facebook page so that I can answer your questions. Making sure I'll do more research on the artificial kidney, but other than funding, there's been some complaints in those who are blocking the funding, and because, artificial kidney means the option is it as good as dialysis, or is there other things that are needed to be done in addition to it? And that has been a question in terms of, does it do all the job that's need to be done, or will there be additional things that need to be supplemented in order to do that? And so there's a lot more work being put into seeing if xenotransplantation would work in terms of being able to see if we do knockout knockout genes from pig kidneys that will be able to be accepted into humans may be a better option, because with that, that if we can overcome the rejection, you can get long-term results. And so that is the debate, and we can bring that to the table with the next session. So I make it my job to do some homework and be able to address that issue the next time we meet. So I appreciate you guys hanging in there. Albert and Lupita, continue to be well, do the best you can, keep healthy, make sure you advocate for yourself, advocate for others, because you'll find that there are other people who do not have that ability to advocate for themselves. So you want to make sure that perhaps you can use your voice and you can use your knowledge to lead people in the right direction. And sometimes we don't know why we're placed in a situation. And so if it's there to be a light to other people, then maybe that is your purpose. God bless and have a great day.